Louisiana has some of the highest death rates in America from breast, cervical, and colorectal cancers. Screening is the best way to reduce deaths by detecting cancers early, when they're easiest to treat. My name is Dr. Bilikisu Ilawanibi, and I'm the Program Director of ScreenUp. ScreenUp works with clinics across Louisiana to improve breast, cervical, and colorectal cancer screening rates by creating tailored, sustainable changes. We work with clinics to implement quality improvement best practices and evidence-based interventions based on national expert guidelines. By using strategies that are proven to be effective, clinics improve the quality of services and increase cancer screening rates, which in time reduces healthcare costs and saves the lives of more patients. One of the clinics we work with is CareSouth Medical Dental.
I am Dr. Gregory Garner, Chief Medical Officer at CareSouth Medical Dental.
My name is Adrienne Bailey. I'm a RN Care Coordinator in Quality Department.
I am Samantha Bangale, and I'm the Director of Quality here at CareSouth. CareSouth is a federally qualified health center that serves in the Baton Rouge area.
The community that we serve at CareSouth is primarily African American.
So our role is to take care of all individuals that enter our doors. But mainly we take care of a lot of Medicaid population or underinsured or uninsured. So we began working with ScreenUp in 2020. What about ScreenUp working with American Cancer Society?
One of our representatives, Jasmine Watts, actually recommended us to engage into this program to be able to improve our colorectal screening work. ScreenUp has definitely assisted us with workflows, being able to identify gaps and areas that we definitely need an improvement in as far as within our electronic medical records.
They really taught the importance of the morning huddles, the support staff, the nursing staff, researching and seeing who needs the colon screening, prepping the patient that discussion is going to be had the next day when they come in with their provider. The provider seeing that order and then deciding after having a discussion with the patient which screening test would be appropriate for the patient. So it just helped implement a better clinic flow.
As far as our policies, protocols, ScreenUp has given us multiple examples and guides to be able to assist us with constructing those items, as well as our process map, our current process map. We did not have that prior to working with ScreenUp, as well as our colorectal standing orders as well.
We wanted to continue working with ScreenUp after that first year when we saw the bump in the numbers, because if we had learned that much information and had improved that much in a short period of time, we just figured, who knows what a second or a third year, would bring.
So initially, we're pretty much just doing outreach through phone calls. Up to now, we have different avenues of reaching the patients as far as getting information to them through text messages, phone calls, sending letters. I think we have like a more structured approach that we use now since working with ScreenUp, and that's helped a lot with getting the patients to actually respond back.
It also made us look at, okay, well, how are we going to get the people colonoscopies that need colonoscopies? So it made us look at what were those barriers. So it was long wait times with the local GI providers here. So that prompted us to reach out and start building partnerships with just any GI that we could find. So we hooked up with a group that was out of Thibodeau and Metairie. So now we got our patients access. They can be seen within weeks, within days, right? But now the problem is distance for the actual procedures. So then that led us to, okay, now we need to try to work on a partnership with a local GI doctor, which we were able to do. And then next you have to work out, okay, now we got one local, but now we still need transportation. So reached out to our CEO, great Matthew Valère, and he came up with a plan to provide CareSouth transportation. So all of our patients have transportation to their visits.
And our success with Screen Up is also attributed to our great leadership here at CareSouth. Our Chief Executive Officer and our Chief Operations Officer, Cabrina Smith, their buy-in was extremely important with helping with our success.
Overall, I feel like the partnership with Screen Up has been great.
Our initial screening rate was 16%, and currently we are at 41%.
And each year I see something more that we're doing, in regards to colorectal screening. It seems to be improving year after year, which is exactly what we want to see as a clinic and which is exactly what we need for our patients.
Screen Up has helped us be able to keep this kind of on the forefront of our goals and just making sure each month that we are evaluating what areas we may need to improve in or what's actually working.
It has also spilled over and helped us to think along the same lines for all of our screenings: breast cancer screening, cervical screening, even vaccinations.
Screen Up is definitely a program that every health center should want to engage in, especially if they are dealing with barriers.
It allows you to see what you're good at, what you're doing well, and then also connect you with other healthcare facilities that are similar in nature to your facility, and you're able to bounce ideas off of those providers.
I would definitely recommend other clinics to work with Screen Up because we know firsthand that it works, it's beneficial to both your clinic and your patients.